All right, good afternoon, everyone. Thank you for joining us for Carthage Area Hospital's Community Engagement Series. Today, we're going to be learning more about diabetes. Diabetes is a national problem, but the good news is with some changes in our lifestyles, we can avoid type 2 diabetes, and we're going to learn a little more on how it affects us and what we can do to prevent that. I want everyone to know, please, that today's presentation is being recorded. We will be posting this to YouTube after this afternoon. I'd like to introduce first to you Natalie Burnham, our Chief Operating Officer. And Natalie's going to talk a little bit about our hospital and where we're at with our new build. Natalie?
Hi, everybody. Thank you so much for joining us today. And thank you, Dave, for the introduction. I'm Natalie Burnham. I'm the Chief Operating Officer here at Carthage Area Hospital. We're happy to have you all. And thank you so much for jumping on today. This obviously is a little different from what we're used to doing and what we've done in the past, where we've all been able to be together and have some lunch and actually see our wonderful speakers, but you'll still be able to hear our wonderful speakers today. So welcome to the group and thank you again for your time. So as most of you know, we are a critical access hospital. We serve Jefferson, Lewis, and St. Lawrence counties. We actually have seen a real increase in the number of patients we have coming to the facility in the last year. We think that's good news and based off our ability and our staff's ability to provide excellent customer service and patient experience. We are in the process of beginning a new replacement hospital for our current facility. The current facility was built opened in 1965. Last renovation was done between 2007 and 2010. A significant portion of the hospital is very old and in need of repair. The mechanical systems and all of those other things, as you can imagine, are very outdated. And if you think about construction in 1965, there's things here that we don't want to upset. And so we are looking at a replacement facility in which we will bring all of our clinics, so all of our outpatient clinics and services together with our inpatient and our hospital proper. That will be located over by Meadowbrook Terrace, by the high school, in that vicinity of the Carthage area. So thank you once again for joining us. If there's questions, I will certainly entertain those questions. Otherwise, I'll let you get back to business.
Thank you, Natalie.
Thank you.
Our first speaker is going to be Dr. Jason Forni. He's our podiatrist. He's going to talk about how diabetes affects your feet. Some house rules here, if you will, please mute your microphone if you're not speaking, and please use the chat box to ask questions. Thank you. Dr. Forni.
All right. Well, thank you, everybody, for having me here. I'm excited to do this. So let's go and learn about how diabetes can affect your feet and why it's so important. So diabetes, it can affect the body in a few different ways. One of them is in how well blood flows to areas. This is important for your feet because the blood's going to flow more slowly or not get as much of a blood flow down to your feet. When you get some of these vascular changes, that can cause you to have slower wound healing, have difficulty healing wounds, and sometimes can even get to the point where you can't get a wound to heal because there's just not enough blood flow getting down to the tips of the toes. Another way that those high sugar levels can affect your body is when they bathe the nerves. They can cause the nerves not to transmit sensations quite as well. And when that happens, you lose some of your feeling in your toes. It's usually kind of a slow, gradual process. And you can end up to the point where you can't even feel, your toes being touched, or you can step on something and not realize that you stepped on anything. That obviously is not a good thing. And we tend to, find those objects and furniture pieces and sharp objects with our feet a lot of times. So it's not a good thing. Also, it tends to affect your feet first, with those being the furthest point from your brain to process those sensations. Skin changes also go along with diabetes. They can change the amount of moisture in your skin. So it's really easy to get dry skin, along with other, there's some other dermatologic conditions that can go along with it. But especially here in the North Country in the winter, where we have the heat already pulling moisture from our skin, when the furnaces turn on, then it makes it that much harder to keep your feet from getting all dried and cracked out. Also, it's really easy to get changes to the nails, either from the changes in circulation. It can make it easier to get fungal infections. You can have doesn't really make ingrowns more common, but it does make it where an ingrown is a bigger deal for someone who's diabetic than someone who isn't. And the other big way is that it does some changes to your immune system, and it makes it not function quite as well as it should. So it's much easier to get an infection, and it's much harder to fight the infections off. All of these things combine to, make it very easy for there to be problems, especially in your feet. If you don't have good feeling, you can get an ingrown toenail, or you can step on, something that's laying around in the house that creates a wound. You have a weakened immune system that, makes it easier to get an infection. You have decreased blood flow. It makes it harder to heal those wounds, so that wound stays open longer. It's easier to get the infection, and then you get an infection, and that can cause all sorts of issues and bad things that we don't want to have to go through. So, such as, you can get ulcers, and you can even get gangrene if, all of that is bad enough. And so you can lose toes and lose different parts of the feet, and, have issues that you don't want to have to deal with or go through. So more specifically, how does diabetes affect your feet? We talked about the fungal infections already. Fungus lives around us everywhere, especially in, pool areas, shower areas, gyms. You try and do good things and get in shape, but you're, exposing yourself to different bacteria and fungus that may be living in that area. And it's much easier to get a fungal infection if you're diabetic. Slow and difficult to heal wounds. We kind of touched on this already. There's a certain amount of oxygen that needs to be carried down to wounds, which is carried through your blood supply. So if that's not getting down there, then you're not going to get the healing that you need to have to close those wounds. Ulcerations, this is basically when you get one of those wounds and they don't want to heal. They can, be fairly large. They can be fairly small. They're very difficult to heal. It's easy to get infections in them. They can get deep and down to the levels of the bone, or into the, areas where there's nerves or tendons, which can cause you to lose, muscle function, lose more sensation, get numbness and tingling. Bacterial infections, these can be, relatively minor, or they can be really severe. They can be superficial. They can go all the way into the bone. They can form a pocket, which is called an abscess, inside your foot. Those are, very painful, and also like to spread to other areas. Osteomyelitis, that's a big fancy word for saying you have an infection in the bone. This is never a good thing when it happens, because it's not really something you can cure. You can kind of make it go dormant through the antibiotics and suppressing it, but it sometimes likes to flare back up and reoccur. And oftentimes when you get that infection in the bone, the solution for getting rid of it is to remove the infected bone, which results in amputations or loss of some of the function in the normal structure that you would have in your foot. Diabetic neuropathic pain. So when you start to lose some of that sensation in your feet, you can either have that be a non-painful process or a painful process. Some people, the sensation just slowly goes away. And in other people, you can get those burning pins and needles, electric shock, tingly feeling, painful feelings like your feet are on fire. And that's all the result of the nerves kind of shutting down. And everybody's process with that is a little bit different, but for some people that can be a very painful experience. Dry skin, like I said, with the skin changes and loss of moisture, you can lose a lot of that moisture in your foot, so you can get those cracks and fissures and hard heels that break apart, and you get those fissures in them. Those usually hurt and don't feel very good. They can also be a source of infection to let that get into the body. And Charcot foot, this one is difficult to explain, so I'm going to show you a picture. So there's a picture of the diabetic foot ulcers, and you can see the different depths that those can get. And then Charcot foot this is kind of a picture of what a normal healthy arch and foot would kind of look like. And in Charcot foot, what happens is through the combination of the loss of sensation and the changes in the blood flow, you basically get a collapse of the middle part of your foot, and the whole thing just sinks down and collapses on top of itself, which tends to create a lot of pressure points, which open you up for new ulcerations, gives you a really bad flat foot, which can cause, pain and loss of some of the function of your feet. It's kind of a in-stage kind of condition. There's not great fixes for it once it gets to that point, and the whole foot just kind of collapses in on itself. But that can eventually happen with it as well. So what do we do to keep all these things from happening? That's the million-dollar question. So one of the most important things, of course, is keeping your sugars under control. That's going to help head off a lot of these problems, and hopefully keep from progressing into those different conditions. So the better control that you can keep on your sugar is usually one of the best things you can do. For your feet in particular, daily self-foot exams. So basically just taking a look at your feet on a regular basis, and especially if you don't have good feeling or good sensation, so you can head off little problems before they become big problems. If you stepped on something, you can keep an eye on it, put a Band-Aid on it, keep it clean, try to prevent infections. If things start to look like they're getting out of hand and starting to look infected, catch it when it's small and early. It's a lot easier to treat than, if it's gone to the point where it's, gotten deeper into your foot. Be careful about walking bare feet. Protect the feet, especially if you don't have good sensation, because there are always those little things out there hiding in the carpet or the rug or anything else that wants to, find our feet, unfortunately. So be careful with them and take care of them and protect them. Finding shoes that fit correctly. Usually you want to look at getting your shoes at the end of the day, because your feet are going to swell. And so sometimes a pair of shoes that feels really good first thing in the morning might be really tight later on in the afternoon. You want to check, after you've worn them for a little bit, and look for any pressure areas or areas where it's rubbing at. If they're causing pressure areas, you probably don't want to keep wearing those shoes, because they can actually, over time, create blisters, or even, rub a small ulcer into the top of your foot. You definitely don't want any of those pressure areas. So you don't want a shoe that's too big. You don't want a shoe that's too small. You want one that feels comfortable and, fits and doesn't rub anywhere. That's the big keys you're looking for with that. So areas that are dry, you want to especially moisturize them. That will keep them from drying out and cracking and fissuring. Skin's our first layer of protection against infection and other things getting into our body. So we have to take good care of it to keep it from allowing those things in and from breaking down. So we want to moisturize dry skin. Kind of the opposite area, you can have places that retain too much moisture. Usually you're going to find this in between your toes. The way that you'd know you're retaining too much moisture is it looks, white and pruny, like you've been in the bathtub or the swimming pool for too long. That skin also isn't good, because it has a lot of moisture, but it has too much moisture. So that makes the skin get weaker, and it's also easy for it to tear and to get cracks in that area because of that. It's also a good breeding ground for fungus and for bacteria and for other things to get in there. So they like to hide in between the toes. So when you're doing your daily foot exams, you definitely want to and check that area and make sure there's nothing hiding in there as well. Trimming the toenails properly, that's a very important thing to do. Like I said, getting an ingrown toenail can be a bad thing for a diabetic. It's another area that infection can get into the body and cause issues. Basically, you want to try and trim them as the same shape as your toe. And you want to avoid, cutting cuticles or pushing them back too far or doing things like that that opens up those natural kind of protective barriers that we have there. You want to, at least once a year, get a regular foot exam, either by your doctor or podiatrist. What they're going to do is test the pulses, test your sensation. It's usually a very slow process to lose your feeling in your feet, and oftentimes you don't even notice it until you go in for those exams. And we're doing the tests where, we touch you with a little piece of wire or a tuning fork to kind of see if you feel it. And a lot of times, the first time you realize you've lost your sensation is when we do that, and you look down and you go, wow, you're touching me on the foot with that, and I didn't even feel it. So that's an important part. And did I mention, daily self-foot exams? That's probably, one of the biggest things you can do is looking at your feet and heading off the little problems before they become big problems. So that's just a quick overview of, your feet and how diabetes can affect it. So thanks for letting me be here, and I appreciate the opportunity to talk to you.
Thank you very much, Dr. Forni. I appreciate you sharing that information. Next speaker will be Carly Draper. Carly is a nutritionist and certified diabetes educator. Carly?
Muted. There we go. Hi everyone. Thanks so much for joining us, and thank you, Dr. Forni, for that really good presentation about foot care and the importance of that in the scheme of diabetes. This is one of my favorite topics of conversation and education, and it's not because I love diabetes. Diabetes obviously is a very challenging disease to have. It runs in families. It's very rampant in our area especially, but it is also something that's really important that people know they can manage. And one of the things that I hope to convey is how you can do that through small changes and kind of some topics around that. So I'm going to share my screen with you. Let's see, hopefully I can. And you're going to see yourselves for a moment. But okay. So my hope is that I can help you to better understand how and why this topic is so important and how you can manage it. So I have this picture because I feel like pictures speak 1,000 words, and I obviously don't have 1,000 words to kind of convey all of this information, but globally, it's really important to understand that people are continuously being diagnosed with diabetes of all ages. This is whether it's type 1 diabetes or type 2. There's a lot of variations in, the age spectrum that we're seeing people getting diagnosed these days. And, there's lots of speculation around why and what's different now than it was back then. But you can see as the states change colors, the darker the color, the more change. That means that there's a higher prevalence of diabetes being diagnosed. And so every year, roughly 6 million new cases are diagnosed. And so I think that's important for people to know, because you're not alone out there if you are someone who's just found out that you have diabetes. And there's a lot of support and care in your area. And you just, I want you to, feel encouraged to find that support for yourself. But like Dr. Forni kind of mentioned, he talked a lot about keeping your blood sugar in control. I think it's important to kind of know what's happening in diabetes. It's not necessarily something that you did by what you're eating. It could be a genetic defect that's in your system, but it's also, certainly impacted by what we eat, because it's an error in metabolism. It's an error in how our body uses the food that we consume, and then how that sugar, once it's broken down, is brought into the cells. It could be, an issue of insulin not being present in enough quantity. It could be that the cells are resistant for some reason to the insulin that your body is making, Or, it could be that we're just eating too much. And so that's also a component that we have to talk about today. So there are two main types. I'm not going to go into great depth on each of these, but these are the two that most people commonly consider when you hear the term diabetes, which is type 1. And so there's type 1 and type 2, sorry. Type 1 is where an individual is unable to make insulin for themselves. And in that case, they do need to use injections to do so, to take insulin to manage their diabetes. In type 2, which is a much more common type of diabetes, which we see more prevalently in our area and in the world, it's a type that is not necessarily because you're not able to make insulin, but you might not be making enough. You may have insulin resistance. That's also what is called insulin resistant diabetes. But there are things in both types that we can do to help manage what our blood sugars look like and how we can kind of live a long, healthy, and happy life. So I like to kind of talk about, how do you know if you have diabetes? Because a lot of people may or may not even know if they have it. Some people can walk around 12 to 13 years without even having any inkling that they have a condition because they don't go to the doctor necessarily very often. Maybe they go because, they're not feeling that great. They have a cold and all of a sudden the doctor says, hey, I want you to get some blood work done because we haven't done any in a little while. And then they find out that they have some hyperglycemia or high blood sugar, and they have this value of an A1C. So the A1C is a value we use to diagnose diabetes, and it's essentially a percentage of sugar molecules that are sticking to our red blood cells. And so we have a number of red blood cells in our bodies. They change over every 90 days. But in someone who has diabetes, those blood sugar molecules, the little blue dots, actually become more in quantity. There's a lot more of them sticking to the red blood cell. And so when we get those values, we often, can then say, there's something going on here. There's an abnormal result here, and we need to look at, what's going on. And so you'll see different values. They go up and down yearly, all through the rest of life when you have this diagnosis of diabetes. Sometimes those values can be pretty high when you're first diagnosed. So you might see a value that's closer, to 10 or 11 or maybe higher. That's not uncommon. It's something that we can certainly address more immediately, but that's why it's so important that you do seek out medical attention if you're having any conditions like Dr. Forni talked about, wounds on the feet not healing well or not feeling sensations and having some numbness and things. Those can be, symptoms of blood sugar abnormalities that you may not recognize. And so seeking out medical help and support is important. But ideally, your A1C, so on the right-hand side, this is what your blood sugar would look like if we did, a finger stick. But on the left-hand side are these numbers, and this is the A1C. This is the value that tells us the percentage of sugar molecules that are sticking to your red blood cells. And the higher the number is, that indicates that there's not as good of control of your diabetes management. That may mean that medications need to be brought in. That may mean dietary changes or some support there, which is, kind of my forte. But ideally, we want your blood sugar to be, or your A1C to be less than 7. That's kind of the target and the goal. And so that can be achieved through a number of different ways. And so with this conversation, and even with Chris Bradley, who will be following me, you can kind of learn about some different ways to help manage those sugars. Unfortunately, what we know about diabetes is that there's lots of different organs that play a part in our high blood sugars or hyperglycemia. And I can't cover all of those topics today, because of our time constraints, but it's important to kind of know that there's a lot of different ways that food can impact some of these organs. And there are different ways that medications can also impact that and help to improve your blood sugar control. So these are typically the pillars that we try to focus on when we think about diabetes care. Obviously the first one being healthy eating. That's something that I'm going to be talking primarily about today, but also, making sure that you're following up with your doctors, you're addressing your blood sugar and medication plan, trying to be more active, things like that. So these are some components that are important for any individual with diabetes. And so we want to make sure we cover those to the best of our abilities, but we won't hit on all of them today. So healthy eating is kind of something that's sometimes a misnomer. It does not mean you have to eat rabbit food and cardboard to be healthy and have all fruits and vegetables always, all the time. What it really means is incorporating a variety of foods and trying to incorporate them in a way that is more balanced in the types of foods that you're eating at one time. That it is incorporating the healthier items like your fruits and vegetables, because they do contain a lot of fiber and a lot of micronutrients that are very good for immunity and give you a lot of vitamins and minerals that are needed for metabolic processes. But it doesn't mean you can't have some of those favorite foods. You can still incorporate those. We just have to know how and what that looks like. So ideally, right, our blood sugar is impacted every single time we eat. It will always fluctuate up and down, left and right in some cases, in some people's minds. But a lot of the impact of our blood sugar, or why those numbers go up or what those numbers are impacted by what we are eating, how much we're eating, right? So if you eat a half of a cup of corn, that probably is okay. But if you're eating, 3 cups of corn, that might be a little bit much on the system. So we have to incorporate how much, or portion size. And then when we eat, believe it or not, is also very important. Making sure that you're eating consistent meals is a key to making sure you're eating healthfully, getting the nutrition you need, but also managing your blood sugar. Because if you were to eat one giant meal a day, your body has to process all of that food at one time, which is really taxing. Additionally, once that food is all digested, all of that sugar, all the stuff that comes from our foods are going into your bloodstream, and your cells are trying to cover what it can. They try to take in the blood sugar appropriately, but maybe they just can't handle that amount. So how often we eat is a really important part of healthy eating. So I'm a visual learner. I like to have, visual images to help me remind myself of what foods I need to know about with diabetes and what foods are really the ones that are driving sugar. And the one we hear about the most is, of course, carbohydrates, or carbs for short. Carbohydrates are not bad. They get a really bad reputation, but they're really not. It's just that we tend to overconsume them. So if you think about food in this way as just carbohydrate, I want you to picture in your mind a bag of flour and a bag of sugar, okay? Any food that has either of these ingredients or both of them together are now going to be considered a carbohydrate. And they are going to be foods that we eat every day, and they'll raise your blood sugar. They're designed to do that. But how much we have of each of them and how much of the sugars in there versus maybe the flour or the whole wheat flour will make an impact on how quickly our blood sugar goes up, or how much extra sugar might be in our system. So these are some foods or food groups, because we often look at the food groups as a My Plate focus. The food groups that contain carbohydrates or carbs are your starches, which are your breads, your grain, your pasta, rice, crackers, cereals, right? Also in that group are your fruits and fruit juice. Now, fruit is a really healthy option for, incorporating into your meal plan, but how much of that fruit will make an impact. And then the form that it's in. So if you're having raw, fresh fruit, it's going to be a lot better on your system because your body has to break it down a lot more, versus fruit juice, where a machine has actually broken that down and made it into a liquid sugar, which might raise your blood sugar more. Now, fruit juice is certainly okay to have. It's just encouraged to have less of it, and try to go with the fresh fruit most often. Milk and yogurt often get forgotten in the scheme of carbohydrate because we think of milk and yogurt as dairy. Well, milk also has a form of sugar in it called lactose. So lactose in the milk will raise your blood sugar. It's a form of sugar, right? Because we know that a bag of flour or a bag of sugar, regardless of what kind it is, will raise your blood sugar. So if you're a big milk drinker, certainly milk has some really good health qualities, but you want to incorporate or consider how much sugar you might be consuming through that source and maybe make some adjustments there. Starchy vegetables are also going to raise your blood sugar. They are a carbohydrate. So potatoes, corn, and peas are the big three. You just want to keep your portion sizes small. It's not that you can't have them. It's just that you want to just really kind of adjust your size, how often, that sort of stuff. And then, of course, believe it or not, my favorite group, sweets, candies, cookies. I do have sweet teeth. They were passed on to me from my dad. But sweets, we know innately, are really full of sugar, and they are going to have a pretty strong impact on our blood sugar values. So we want to keep those smaller. In addition, there are some foods that don't raise your blood sugar that you need to know about, and those are your meats or your protein sources like meat and eggs. It could be a vegetarian protein source, and then fats and oils. Now, I'm not encouraging you to go out and eat a stick of butter instead of having some bread or a sandwich, but you want to incorporate some of those in smaller quantities in a pairing and just understand kind of which ones are raising your blood sugar and which ones aren't necessarily raising your blood sugar, but are also important to kind of consider in a meal plan. So here are some sources of protein. I'll go a little bit faster. Whoop, just kidding. I'm going to go back up. Protein, just so you can kind of see some options. And there is an important part of grains that do contain some protein. So, don't feel like you have to go out and become a carnivore and eat a bunch of meat if you're someone who is vegetarian or vegan. Just know that there's importance to having protein in your meal plan as well. And then, of course, healthy fats, working to have more of the healthy fats incorporated, less saturated fats. So these are things like olive oils, plant-based oils. They're important to keep in mind when you're having them, keeping your quantities small, but also incorporating them in a healthy way. So this is the healthy plate, I guess, for diabetes. Is a way of kind of using a simpler method to incorporate a healthier meal plan. Trying to have half of your plate being non-starchy vegetables. Those are the ones that I didn't say. So potato, corn, and peas actually go in that grains and food section and starchy vegetable section in the corner. But the non-starchy vegetables are more like your salads, your broccoli, green beans, right? Cabbage, things like that. And then, of course, making sure that you also have protein at your meal. It's important to have a combination of these foods together at each setting when you're eating, because they work simultaneously to kind of help promote healthy weight, but they also help to control how quickly your blood sugar is going to rise and fall and give you that satiety that you may not always feel when you have diabetes, because our bodies utilize our nutrients so differently. So kind of keep that mental image in your mind. If you follow this and kind of aim to have this type of look to your plate at each meal, you typically will have very, very good management of your blood sugar because you're incorporating fiber, protein, and the carbohydrates, which raise your blood sugar. Physical activity, we can't talk too much about, but it's just important to know that physical activity, movement, will also help to control your blood sugar. So I like this comic strip just because, it incorporates the kitchen and food, that exercise really isn't just wandering around the kitchen. It's taking a walk. It's going up and down stairs. So making sure that you're moving can also be important in that blood sugar scheme and keeping it controlled. So making healthy food choices, there's a lot of ways to do that. If you're looking for more support in what a meal plan might need to look like for an individual or even yourself, please do reach out, because this is something that is very individualized. We're not cookie cutters. And so what works for one may not work for others, but these are some typical things that you can do to help improve your meal plan and make it a little bit healthier in the relation of diabetes and just overall general health. So I am going to move into some conversation about glucose monitoring, because I think it's important as we move into Chris's presentation that you understand that monitoring your blood sugar is really the only way to know what your sugar is. So using that glucometer is important to know what your number is, because we know that food raises our blood sugar and we know that physical activity lowers our blood sugar, but we also have medications that get prescribed for us that also impact our blood sugar. And we need to make sure we're keeping track of what those numbers are. So checking your blood sugar is truly the only way. Your doctor typically will prescribe for you when they'd like for you to check your blood sugar. And so these are just some tips and things around glucose monitoring or blood sugar checking that can be very, very helpful to help get your blood sugar in better control if it seems like it's poorly controlled at this point in time. These are some values you want to look for or targets to get your blood sugar in more or better control, aiming for that A1C of less than 7. As you can see over here. And before meals, trying to really get your blood sugar to 80 to 130, or after meals about less than 180. Ideally, we'd like to see it closer to 140, but we're all a work in progress. And so every effort you make toward improving your health is a positive one. And sometimes this can be something you find the most helpful in managing your diabetes. So I'm going to transition over to medication, the medication plan, because that is a big part of how we manage our blood sugar. And I will let Chris take over. Thanks so much.
Thank you very much, Carly. We appreciate that information. Our next speaker is Dr. Christopher Bradley, our clinical pharmacist here at Carthage Hospital. Dr. Bradley.
Thanks, Dave. Just going to share my screen here. All right. So thank you, Dr. Forni and Carly, for those great presentations. Always informative. I really do enjoy these community events. So it's great to be speaking at this. Today we'll talk about effective medication choices for type 1 and type 2 diabetes. I could spend 2 hours talking about this and going through the details of everything, but this is more of an overview. And if anybody has any more questions or wants to talk to me further about it, I'd be happy to set up an appointment with you. So type 1 diabetes, as we've talked about, the body doesn't make insulin on its own, and we need exogenous insulin to treat it. This often is diagnosed in the early stages of life, but it can be diagnosed at any point in a person's life. Just happens more often than not in youth. So an important thing with type 1 and type 2 diabetes is monitoring your own blood sugar. So BS equals blood sugar. And depending on the treatment plan, your doctor could have you record it sporadically or multiple times per day. Typically, in the early phases of being diagnosed with diabetes, the physician will have you monitor it several times a day until you get on an established treatment plan, and then it may drop down to 1 or 2 times a day, or even once or twice a week, depending on how you're doing and how your A1C is doing, which Carly explained what an A1C was in her presentation. Many glucometers have programs that can actually record sugars by connecting it to your phone or your computer. And this is really great because if you have this, when you go into your doctor's office, you can just pull up your phone and show him him or her, all your different your values over the last week or a month or even 2 or 3 months. Since an A1C is monitored every 3 months, physicians often will have patients monitor their blood sugar and then come in with 3-month averages and look through it. So, if you're not very savvy at your phone or you're not a big fan of computers, you could also keep track of it on a log journal. That will work just as good. So glucometers are used to keep track of blood sugar. With a glucometer, alcohol swabs are required to swab the skin, test strips, pen needles, the actual glucometer itself, and a sharps container for disposing of the pen needles. When I used to be a community retail pharmacist, I used to see patients a lot of times. They would get prescriptions sent over for the glucometers, the strips, and then the doctor wouldn't send the prescription over for the pen needles. So it's important that if you're a newly diagnosed diabetic, your doctor sends over a prescription for the pen needles as well, because a lot of glucometers are useless. A lot of insulin pens are useless without these pen needles. I should say that. Some pharmacies have low-cost options. Price Chopper is the cheapest place to manage your diabetes care. Make sure you tell your pharmacist, though, if you go to Price Chopper and get your diabetic medications and you say fill your prescriptions at Walgreens or Kinney's for everything else, that Kinney's pharmacist and that Price Chopper pharmacist both need to know the medications that you're on, as some medications can affect other ones. At Price Chopper, I know they even have some free medications. Metformin is free at Price Chopper. The Meparide, Glyburide, those are a few that come to mind. And they also have some very inexpensive test strips as well. So this is a great option for patients that don't have insurance or patients that have insurance that happens to have a high deductible. So hypoglycemia, very important to understand the symptoms of that. Low blood sugar, that is the definition of hypoglycemia, but patients can become dizzy, sweaty, confused, in severe hypoglycemic events, unable to eat or drink, seizures, convulsions, unconsciousness. If you are experiencing any of these things, the quickest way to get your blood sugar up, there's a couple different ways. A glucose tablet is very quick. They're inexpensive to purchase at the drugstore. And a glass of orange juice is also a great way to get your blood sugar up quick. So I always recommend patients that have diabetes to keep half a gallon of orange juice in their house in case they have these events, especially in a newly diagnosed diabetic. They tend to experience hypoglycemic events more frequently than somebody that's been diagnosed for years and is on more of an established treatment plan. So what can cause this? Several things can cause it. Skipping a meal, you drink alcohol without food. Some illnesses can cause hypoglycemic events. If you increase your physical activity too quickly, that's why we recommend diabetics to go up gradually with their physical activity if you're going to start exercising again. And this is, as I spoke of, 4 glucose tablets, some fruit juice, a can of soda will help get your blood sugar up, not diet soda, the full, Pepsi, Coke, Mountain Dew, raisins, sugar, honey. But I always tell patients just keep a half a gallon of orange juice in your refrigerator. That's probably the easiest thing to do. On the other side of the spectrum, you have hyperglycemia. That symptoms of that: frequent urination, increased thirst, dry mouth. However, if you're in the company of somebody else and they say, boy, your breath smells kind of fruity, like you've been eating a fruity kind of gum or a fruity kind of food, you need to call 911 immediately. Those can be signs and symptoms of something called diabetic ketoacidosis, which is where the blood sugar gets very high very quickly, and without being treated, it can actually be life-threatening. So several medications used to treat diabetes. I'll just go over a few of the more common ones, metformin probably being the most common medication to treat diabetes. It's important to note that it only will treat your type 2 diabetes, not type 1. Remember, because in type 1 diabetes, your body actually doesn't make insulin, whereas in type 2 diabetes, your body does make insulin, but it is not very sensitive to insulin. Typically, the first medication prescribed to a type 2 diabetic, it is free at Price Chopper, and several other stores, pharmacies have it on their cheap list. I know Walmart sells it for $4. I believe Walgreens also has a version of an inexpensive generic list. And what it does is it makes your body more sensitive to insulin, so the insulin will actually work better that your body already produces. Medications: glyburide, glipizide, glimepiride, again, free medications at Price Chopper. These medications have a nasty side effect of low blood sugar, and it actually is a frequent side effect. So I always tell patients that that may not be the best medication to be on, and you may want to discuss other options with your doctor. Remember, in type 1 diabetes, your body doesn't make insulin, so you have to inject insulin yourself. Your total daily dose of insulin is actually calculated off of your body weight, and it's usually split between a long-acting and mealtime insulin. So, an example, myself, I weigh 188 pounds, depending on if it's the holiday season or not. If it's the holiday season, I might weigh 195 or so, but let's just take the average of 188, which calculates out to 85 kilos. So using 0.6 units per kilogram, my total daily insulin requirement if I had diabetes would be 51. Therefore, the initial dosing would be half of 51 of a long-acting insulin, which would be Lantus or Levemir, and then half of a mealtime insulin, which would typically be regular insulin or 70-30. And like I said, Lantus, Levemir would be the long-acting, and then 8 units before breakfast, lunch, and dinner of short-acting or even intermediate-acting insulin. So how do you inject insulin? Well, the pens have become very popular. It's easier to dial the exact dose with a pen versus drawing it up in an actual syringe. Insulin pumps have also become quite popular with patients, but the injection sites include the abdomen, the thighs, and the backs of the upper arms. Very important to remember that when you do inject insulin, you have to swab yourself with an alcohol pad first to avoid infection when injecting insulin. So storing insulin, just follow the instructions on the insulin label. Unopened containers stay in the fridge. It's typically okay to store insulin at room temperature once it's been opened, but you need to make sure that it doesn't go past the expiration date of room temperature insulin. I believe most insulins are 28 days at room temperature. There is one that comes to mind that's 42, but in general, 28 days is the safe number for keeping insulin at room temperature. You don't want to let it get too hot or cold, so keeping it in a vehicle in the summer or the winter is probably not the best idea, and you don't want to use it after the expiration date on the label. That's the expiration date of the actual insulin itself and the expiration date of when it was opened and stored at room temperature. And for any more information regarding this, I would highly encourage you to speak with your local pharmacist about proper storage and use of insulin. So I alluded to this a little bit before, insulin pen versus vial. The pens are much easier to use than the vials. One thing with that is you need to make sure that you have the pen needles and they actually attach to the pen, and you dial the dose on the pen. And it's really a lot easier to show a patient if they actually have an insulin pen. So it'd be a great thing to ask your pharmacist about when you pick up your prescription, or if anybody did want to make an appointment with myself, Dave can provide you my contact information, and I'd be happy to go through your medications or your insulin with you here at the hospital. Pens are typically a little bit more expensive than the vials. However, the cost has come down significantly. I'd probably say in the last 5 years, as more insurances are covering the pens at the same cost as the vials of insulin. Injection site remains the same with a pen versus a vial. So some strategies to help you save some money, low cost pharmacy options. So I spoke of Price Chopper before. Walmart also has some very inexpensive medications to help manage diabetes. But just make sure that if you get your prescriptions filled at multiple pharmacies, each pharmacy knows what is being filled at the other pharmacy. There's coupon cards that can be used with typically insulin pens, Lantus pens, Levemir pens, 70/30 pens. Some patients are ineligible to use coupon cards depending on the eligibility that the card has set. I know some cards don't allow it for patients that are on government-funded insurances such as Medicare or TRICARE. Just remember that when you get a coupon card, it typically has to be activated by calling a 1-800 number on there. So make sure that you do that before you go to the pharmacy. Otherwise, it can delay picking up your prescription. 30-day versus 90-day supplies. Sometimes 90-day supplies are less expensive with your insurance plan. Something to check with your insurance on. You can call the 1-800 number on the back of the card. And goodrx.com is a discount prescription website where you can actually type in the name of the medication that you're getting, and it will spit you out some coupons and tell you what the cost would be at different pharmacies in your area when you type in your zip code. Lastly, one of the last things I'm talking about is pumps. So some patients have insulin pump that provides a direct line into the body with insulin, and then it's programmed for how much is needed based on what you eat. It's really much more complicated than that. However, that's just kind of a simplified version of that. Something to definitely talk with your physician about if you are interested in that. It really cuts down on the amount of times you have to inject yourself throughout the day if you inject yourself with exogenous insulin. So definitely a conversation worth having with your physician. And lastly, smoking. Never too late to quit smoking. I offer a smoking cessation class here at the hospital for anybody that's interested. We do it virtually now because of COVID. Smokers are 30 to 40% more likely to develop type 2 diabetes amongst the plethora of other illnesses that smoking causes. It can cause increased risk of heart disease, kidney disease, and smoking basically increases your risk factor for almost every disease that can occur in your body. It can also cause retinopathy, which is a problem with your eyes, neuropathy, infections, ulcers, amputations, pancreatitis, lung cancer, pancreatic cancer, esophageal cancer, you name it, smoking is probably linked to it. So just to wrap it up here, your life is not over because you have diabetes. It is a very manageable condition if a patient wants to manage it. I would recommend utilizing technology if possible to help you manage it. So utilizing glucometers that can sync with your phone. That way you can bring it into your doctor and show your doctor the reading. Regular communication is huge between yourself, doctor, and pharmacist. And it's never a bad idea to have some kind of alert necklace or bracelet, which is sold at pretty much every drugstore that I know of. Thank you very much.
Thank you very much, Chris. I appreciate your information. Thank you, Carly and Dr. Forni. I appreciate all the presentations today.